Hello everyone, today I'm going to give a brief talk about testosterone replacement for men. The history of testosterone goes back a long ways. The name was first coined in 1935 and it was first chemically synthesized by the 1950s. The injectable form became the preferred therapeutic modality. It's a common treatment for hypogonadism and now it's becoming almost mainstream. Hypogonadism is a medical term which describes the diminished functional activity of the gonads, which are the testes and ovaries in males and females respectively, that may result in diminished sex hormone biosynthesis or creation. It can be primary or secondary. In layman's terms, it is commonly referred to as low T, and it can occur in men and women. There are many causes of hypogonadism. Some of the more common ones are congenital or acquired disease processes, tumors, inflammation, trauma, chemotherapy, chromosome disorders, damage from alcohol or heavy metals or toxins or drugs, and andropause with aging males, and menopause with aging females. Studies show the current male population has the lowest testosterone levels in history. Belly fat is a key indicator, and it's from many causes. Some of these are steroids in food, estrogenic compounds in food and substances, toxins in the air, and the chemicals in the foods and plastics and things around us, high glycemic diets, and overall poor lifestyle with nutrition and exercise. Now there's optimal testosterone and suboptimal testosterone. Now you can be in the normal range when you check a blood level, but it still doesn't mean it's optimal. When it's suboptimal, you have increased body fat, low energy, poor muscle tone and poor muscle mass, loss of bone density, decline in mental acuity, decline in heart health, poor libido and erection quality, poor sleep, higher incidences of depression, decrease in drive and motivation, and increased risk for heart disease, diabetes, dementia, and cancer. When your T is optimal, obviously all of these are reversed, which is very important. Obesity is the number one cause of preventable death. Obesity and visceral adiposity greatly increased our risk factors for all the common diseases causing death, such as cardiovascular disease, diabetes, and hypertension. Visceral adiposity is the fat located in the perineal cavity, where the abdominal area that surrounds the body's internal organs. In other words, it's underneath the skin, and it's also known as organ fat, beer gut, or the good old pot belly. Visceral adiposity, we can call it the root of all evil for the reasons I mentioned. It usually lessens the quality of life and life expectancy, and there's a positive correlation between visceral adiposity and low testosterone. Low testosterone adversely affects the body's ability to regulate insulin, glucose, and fat metabolism, and it contributes to an increase in adipose tissue. Now, testosterone can be supplemented by various forms. Direct administration of testosterone can be delivered via intramuscular, transdermal, or subcutaneous methods, which are called pellets. They're all acceptable modes, but they all have different technical advantages and disadvantages. Now, you can also stimulate endogenous or basically your own body making production of testosterone by the administration of HCG or the use of Clomid. These medications make your body create its own testosterone, and there are advantages and disadvantages to this as well. If testosterone is given as a shot intramuscularly, testosterone cypionate is the most common form. It has a half-life of 10 to 14 days, and it's not effective if administered monthly, so it's most effective when it's administered weekly. It produces reliable blood levels and can be titrated easily. So typically for men, you're going to start anywhere between 50 and 100 milligrams a week, but it may need to be administered bi-weekly. Transdermal testosterone, you apply it to the love handles, and it has to be applied daily. However, it can be messy and needs to not come in contact with women or children. It can be more difficult to achieve optimal levels in men, and there's a greater chance for elevation in a hormone called DHT, which can contribute to male baldness and prostate concerns. Subcutaneous administration gives long-term levels after placement. And it's an invasive procedure, and it's hard to know accurately when the levels start to decline. This is the pellet I mentioned earlier. Normal levels for testosterone. Now, there's some variability with different lab companies, but in general, total and free testosterone is around 250 to 1,150 nanograms per deciliter and 35 to 150 picograms per milliliter. It's not age-specific, and there's a wide variation between the top and the bottom end. The majority of men would be considered normal, even if they were experiencing symptoms of low testosterone. So just because your levels are normal, if you're having all those symptoms, you still may warrant therapy. Again, here's the optimal levels, and the free testosterone is the most important one to follow. So clinical management, testosterone levels should be optimized by using both blood levels and a clinical assessment of the patient. In other words, how does the patient feel? Every patient responds differently at different blood levels. Target levels should be used as a guide along with treating the patient. It should be monitored by an experienced, qualified age management physician in respect to testosterone and hormone therapy. We have to monitor the blood levels not only of the testosterone but many other hormones as well, just a couple of one of which is estradiol. It's a form of the hormone estrogen. We think of this as a female hormone, but men also need a certain amount. Estradiol is a downstream product of testosterone metabolism. Its production in men may or may not vary in tandem with free testosterone levels, and it can be unpredictable. So if the levels are too high, it can cause gynecomastia, or growth of female breast tissue. So you have to monitor this closely. You don't want it too high, and you don't want it too low. Dihydrotestosterone was mentioned earlier. It's a very potent androgen, and it basically comes from the conversion of testosterone to DHT. It's very important in libido, but in some men it can be too high, and it can again contribute to male pattern baldness or benign prostatic hypertrophy, enlargement of the prostate. So normal values of DHT are between 25 and 75 nanograms per deciliter. And if there's no adverse symptoms, you can be treated, but again, these medications also have side effects as well, so you have to watch for libido and other side effects. Now, red blood cells. Injectable testosterone can stimulate bone marrow production of red blood cells. In about 5 to 7% of patients, this increased production is enough to cause what's called erythrocytosis, which is an increase in the number of red blood cells. So we monitor this with blood monitoring with the red blood cell count, hematocrit, and hematoglobin. They're the technical terms for the blood work that's done to monitor this. Phlebotomy or a blood draw may be necessary if this happens, although this is not always necessary. You have to assess the patient for risk factors for stroke, DVT, or other cardiovascular events. Again, this does not happen in the majority of cases. Monitoring should be, again, testosterone should be prescribed by a physician who understands all the levels that need to be monitored. Again, it's not just about T, it's not just about estrogen, there's many other factors that need to come into play. Some blood levels can be unpredictable and they need to be monitored regularly. PSA should also be checked regularly, and men should have a prostate exam before starting testosterone therapy and also receive one yearly. There's a lot of myths out there regarding testosterone for men. I'm just going to go through a few. One is which it can cause an increased risk for cancer, including prostate cancer, and that's definitely not true. Most studies show that it actually lowers the risk for cancers. Another myth is that testosterone increases risk for heart disease. Actually, it decreases your cardiovascular risk. Studies have shown that testosterone levels, when it's optimal, lowers in all causes of mortality. So some takeaway points for men. There is a zero upside to having a low T. There are countless benefits to having optimized testosterone. It lowers the risk for the number one cause of death, which is heart disease. It lowers the risk for obesity, which is the number one cause of preventable death. It improves lean muscle, bone density, reduces body fat, improves energy, improves sexual and cognitive functioning, and gives better drive and motivation. Lessens your risk for depression and contributes to optimal health and vitality. It should be used in conjunction with lifestyle modification to receive the optimal benefits. So you can't just sit around on the couch and take some testosterone and expect to be built like Adonis. You've got to have a clean lifestyle and exercise frequently. There are many other important hormones that should be optimized as well, other than testosterone, to receive optimal benefits. Just a few of these are thyroid, IGF-1, DHEA, melatonin, insulin, and cortisol. Again, I'd be happy to discuss with us if anyone wants to come in for a free consultation. If you have any questions, please contact me at efate@senegenics.com, or you can call our office at Artemis Health Center at 614-793-8351. Thank you and have a great day.